abuse, cancer,
measles, diabetes, AIDS, cancer,
Good evening once again, folks, and welcome to Doctor on Call. And this evening we have with us Dr. Devron Joseph. He is no stranger to a program. Indeed, he's been with us before, sharing great information. And this month, the month of November, is recognized as Diabetes Month. In fact, Saturday the 14th was World Diabetes Day. And so this evening, we will be talking a bit about diabetes. Diabetes being one of the conditions that affect us here in Grenada significantly. It's one of the chronic conditions that we have a lot of here in Grenada. And, there are a lot of people who still need to be reminded of the importance of protecting themselves from that condition. So it is a good time to welcome Dr. Joseph. Doc, good evening and welcome again.
Good evening to one and all. Glad to be back on the program.
Yes, indeed. It's been a little while, yeah?
It's been a minute.
Right. Yes, indeed. So, November Diabetes Month. We just had World Diabetes Day, and I'm sure you come across that condition on a daily basis in your profession, and of course, some cases are very serious. When it gets really bad, it can actually affect your kidneys, and it can result in loss of life if people are not careful and take better care of themselves. So it's a condition that we have to constantly remind people of and let them know how to protect themselves, and if perchance you already have the condition, how you can live with it, and to keep the effects of that condition down. So Doc, let's start telling us what really is diabetes and how people actually come down with that condition.
Okay. All right. So to get an understanding of what it is diabetes is, the general public, they usually have the mindset that it's associated with elevated blood sugar. So to put that in perspective, whenever we eat, right, we intake calories, especially carbohydrates, meaning things like rice and provision and pastas. Right, these things get broken down into the simplest form of sugar, which is glucose. Right, essentially what we measure in our blood as blood glucose, right, or blood sugar. Right, when that is broken down, that needs to be transported into our cells, and the body has a couple mechanisms, but the main mechanism is through a hormone that we produce called insulin that takes the blood sugar, the glucose from the bloodstream into our cells where it's needed for, just for energy and sustenance. So essentially what happens in diabetes is there's an absolute, which is the least common form, an absolute deficit of that insulin, or what's more commonly happens is there's a resistance to the insulin that your body produces. So the insulin that you're producing does not allow the sugar to go into the cells as it should, right? Resulting in persistent elevated blood sugars, which ultimately damage your cells and other organ tissues and lead to all the host of problems that we see with diabetes. So essentially, diabetes is elevated or persistent high blood sugars due to a lack of insulin or insulin resistance in the body.
Right. There are two types of diabetes, mainly two types of diabetes. Could we just briefly talk about them, what they are, and how you can recognize which type you have?
Okay. So essentially, in the grand scheme of things, there are two types. I mean, there are other rare types of diabetes, but essentially two types, which include type 1 and type 2 diabetes. So the type 1 diabetes is the one I mentioned earlier, where there's an absolute deficit of insulin. Your body is no longer producing the insulin that it needs to control your blood sugar. All right? It's essentially happens where there's a destruction of the pancreas cells that produce the insulin. And that's called like an autoimmune disease, where your body produces proteins that destroys itself. You see that usually in our younger population, see that in young children that get diabetes. You also see that in younger adults, usually in their adolescence and very, very young adults. All right, so that type of diabetes, it has sometimes they have a genetic component, meaning it can be passed on from, or a genetic component passed on from your parents, or a spontaneous mutation that causes your body to destroy itself or destroy its pancreas and results in the absolute deficit of insulin. So that one is type 1 diabetes, and usually you see that in the younger folks, and your doctor would be able to diagnose that pretty early. The vast majority of patients suffering with diabetes, almost 90%, are those that suffer with type 2 diabetes. All right, that's the one that I spoke about with the insulin resistance, where it's not that your body is absolutely deficient in insulin. It's just that the insulin that it has, the blood, your tissue are resisting the action that it's supposed to have. So you have the insulin, but your body is not responding as it should to that insulin.
And in the case of type 2, why doesn't the body respond appropriately?
Okay, so the mechanism that most of our medical scientists and professionals have eventually zeroed in on is that there is what they consider insulin resistance by the tissues. What aids in that is obesity. So truncal obesity, meaning a lot of fat, especially around the midsection, right? It's theorized that the fat cells produce some inflammatory response that causes that insulin resistance. So the receptors on your tissue do not respond as well because of your obesity that
fatty tissue. Okay. All right. We also hear about pre-diabetes.
Okay. So yes. So pre-diabetes, it's a state that is on its way to diabetes, meaning the persons who they don't meet some of the diagnostic criteria, so that so a physician can tell you, yes, you are a diabetic and you need to start a regime on medication, and that's your diagnosis. So it's persons with altered blood sugars, or sugars that are like what you consider high normal, right? Close to diabetic range without being diabetic. And these are persons that have to be vigilant because you're on your way there. So these persons need to already start thinking about dietary changes and to monitor that blood sugar closely, at least annually, to get a checkup, because they can be well on their way to to
becoming diabetic.
becoming diabetic.
All right. So as it relates to your blood sugar level, what adequately what should it be? And that as it relates to being a diabetic and also being pre-diabetic.
Okay. So, a diabetic, we diagnose diabetes using something called a fasting blood sugar. For fasting blood sugar, meaning you cannot have any caloric intake for less than 8 hours. So 8 hours without having anything that has calories, meaning proteins, carbs, fats, anything. Water is okay. Water doesn't have calories. So you would have to be fasting to take that blood test. And when you take that blood test, the reading can, once it's above 126 milligrams per deciliter, that's our measurement. 126 and above is diagnostic of diabetes. So once you have that reading on a fasting blood sugar, you are a diabetic. As it relates to pre-diabetes, we're looking at the high normal. Right? Some, like the Diabetic Association in America and the WHO, the World Health Organization, they do have some different definition as it relates to pre-diabetes. But the threshold is between 100 and 125 for pre-diabetes. The World Health Organization uses 110 to 125, but again, anywhere within that range, you consider pre-diabetic and should be vigilant. All right.
Okay.
All right. There are other diagnostic criteria that your doctor might use. Right. Which I guess we'll get into a little bit later.
Yes. All right. So let's talk about the symptoms. What are some of the symptoms that can cause someone to start thinking, boy, I'm not comfortable with this, I'm feeling that way, I'm feeling this way, and I'm worried that I can have elevated blood sugar level?
Okay. Well, some of the active symptoms for when you're in a hyperglycemic state or when you possibly diabetes, right? Persons usually think about these things after they're diagnosed and they think retroactively, oh yes, these are the symptoms. Or they explain these things to their doctor, and then their doctor might proceed to test their blood sugar. So one might include just excessive urination, right? You all of a sudden you notice that you're peeing more frequently throughout the day, all right? And then as a result, you start drinking a lot more water. Like you're excessively drinking more water throughout the day. All right? And also this constant, almost constant hunger. You feel like your appetite is insatiable because as it relates to your blood cells, they're not getting the sugar they're not getting the sugar into the blood cells because the insulin not working. So your cells feel starved. So you feel starved as well. All right. You might end up with some significant unintentional weight loss. We're not talking about you went on a diet plan and you started to see the effects. No, you haven't changed your diet and you're just having just constant weight loss from someone who was a little bit overweight and they're starting to lose their belly without any significant changes or any exercise regimen. All right. So you think about also, this could be non-specific, but blurred vision. When you associated with these symptoms, you're peeing excessively, you're drinking excessively, you feel the need to eat excessively because you're always hungry, and your vision starts to get a little bit blurry. It's not always consistent because there's other causes of blurry vision, but that can be associated. Unintentional weight loss is another one. All right, that's the general symptoms of that might lead someone to suspect, hey, I might have some diabetes, or maybe I should get that checked out.
Right. I'm also noticing here that if you have wounds, they may take a long time to heal.
Mhm. That's usually when we think about that, we think about with um, persons who've had long-standing diabetes and may
Okay.
have not known, and that's usually one of the complications, right? Because diabetes, because of the elevated blood sugar, they affect the blood vessels tremendously. All right, so that your wound and healing capacity that's diminished, your immune system is even lower. All right, and that causes yes, so ulcers that take a longer time to heal than in a normal person. So that for older individuals, I would definitely use that as a warning sign, even though there might be other causes of poor healing wound, but definitely want to consider.
Right. What about the connection with hypertension? Problems with cholesterol levels. In the case of women, yeast infections and things like that.
Okay. So, as it relates to the diabetes and high cholesterol, that's almost a direct correlate. So it's you have decreased or altered metabolism of your sugars, and diabetes accelerates the process of cholesterol deposits in your arteries, right? In the arteries in your heart, the arteries in your brain, the arteries in your kidneys. That's why it's linked to all of the complications that is associated with uncontrolled diabetes, right? So diabetes accelerates cholesterol deposits in your arteries, which brings on the host of problems as it relates to the damage. High blood pressure, it's in itself, it's a separate entity, but it's just as common. And so they accelerate each other because they both damage your blood vessels and predispose you to all the complications, including the heart attacks and the strokes and the kidney disease, right? They accelerate each other, even though they're two different diseases, but they do damage the same organs. So they're like Bonnie and Clyde, I could say.
Right. So is it very likely that someone who is diabetic would also be hypertensive and the other way around?
Yes, it's the likelihood of that is poorly understood, other than the fact that they're both very common diseases. So common things are common, like we like to say in the medical profession. So someone has hypertension, you'd want to screen for diabetes because you don't want one to compound the other. All right? But because of the high prevalence of both diseases in our population, it's very likely that someone with one could have the other, even though they can and they do occur independently. So there are diabetics who are not hypertensive, and there are hypertensive patients who are not diabetic.
Right.
But frequently you do see persons with both because of just how common the prevalence of disease is.
Right, because I was about to ask if someone is diagnosed as hypertensive and they've taken the necessary measures to control it and keep it, where it is supposed to be. If by doing that they can actually, limit the chances of becoming diabetic.
Yes, they can. They can, in that most of the lifestyle changes and meal restrictions that are associated with high blood pressure can be applied and extrapolated to the diet for diabetics, with some minor, just some minor variations. Because with the hypertensive, their main dietary restriction is to minimize their salt intake, right, which contributes to the high blood pressure. With the diabetics now, their limitations is with the carbohydrate intake,
Sugars.
right, the sugars. all right, and that is the main contributing, at least from a food perspective, to the disease process. If they extrapolate and do lower their salt content and do try to lower their sugar content, they can minimize the onset of diabetes, even though it's not absolute. But both diets can overlap.
Okay, okay. There is something that is referred to as DKA, diabetic ketoacidosis. Explain that to us, because that's a huge term. So help us to understand it. Yes.
Sure. So diabetic ketoacidosis is a medical emergency. It's one of the complications of diabetes when the sugars are elevated for a prolonged period of time, and for very high and for very long. All right. We usually see it in the type 1 diabetics when they present to us in casualty or at the hospital, although it can happen in type 2 diabetes that have not been compliant with their medications, or have been diabetic for so long and they just have ignored the warning signs. So what happens in this medical emergency is that the sugars remain elevated for so high that your body is not producing the insulin to get the sugar into the body, and eventually your body switches over to a different type of metabolism, which it just breaks down all your fats. And the breakdown of fat, although it produces energy, it produces some acidic byproducts, right, called ketones, right? These things build up in your blood and cause your blood to become more acidic. I don't know about you, but anything to do with acid and blood doesn't sound like
right.
a good picture. So that eventually that causes all the problems going forward, because it changes your mental status. The high blood sugars cause the patients to become severely dehydrated, because imagine like all this sugar floating inside your bloodstream. All right, your bloodstream is almost like thick with sugar, and your blood cells that have all the water wants to dilute through the process of diffusion. All right, they try to dilute that sugar in the bloodstream. So your blood becomes a tool for drawing out water from your cells, and you become extremely dry, extremely dehydrated. You start having vomiting, nausea, abdominal pain. All right, and it can be detrimental. All right. So it's a circumstance where the insulin, the sugars are elevated so high that your body switches over to its metabolism to break down fats, producing these acids in the blood, and dries you out and causes you to experience a whole host of problems.
Yeah, if you have, that high sugar level and high acid level, your blood would come like juice.
Well,
it sounds a little comical, but this is a very dangerous situation.
It is. So when a diabetic they start to vomit excessively, right, uncontrollably, abdominal pain, all right. Even they begin to become a little bit loopy and lethargic, where they're no longer as conscious as they used to be. That's some red flags right there, and are signs of diabetic ketoacidosis, or DKA, or as we say for short. And you should have that person rush to the emergency room so that they could be treated.
Right. There's something about this the smell of nail polish coming from their breath. How does that? What causes that? Is that
the fats break down? They break down into ketones, and one of some of the ketones they have an acid component, and then another component called acetone, which is a fruity smell that you can get from persons in that state. So it's the byproduct of all that metabolism. It maybe smells sweet. That's probably the only thing sweet about this disease.
Okay. Very serious aspect of it that I think people take lightly, because there are people who have the impression that, okay, so I am not overweight, I am not fat, so I cannot get diabetes. And we know that is not the case. So let's go to a break. When we come back, we will talk about that. Stay with us, folks. We'll be back with you in just a moment.
It's new, innovative and classy, and it cut above the rest. Your one-stop shop for bathtubs, kitchenette, customized doors and windows, and even a new paint job. We also sell quartz and solid surface countertops. At M&N Hardware, we offer best prices, excellent service, efficiency, and reliability. Visit us at Dusty Highway, Grandin, St. George, or call telephone number 440-6757. M&N Hardware, from foundation to roof. Let's build together.
Despite the situation we now face, one thing is for certain. We will get through this together. As much as we are a part of your community, you are a part of who we are. Let's take care of each other during this time, as we always do. And soon, we know that with the dawn of that new day, all of this will be over, and our land will once again be healed. In the meantime, stay safe. Know that we're here for you. Courts, bringing value home.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carriacou, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Now you love Super 6 even more.
With more money to the jackpot galore.
Play more, win more,
have more fun. With more jackpot money, Super 6 is my number one.
With the new and improved Super 6 game.
Jackpot keep growing and growing and growing.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game. Super 6, bigger jackpots, more chances to win.
evening, viewers, and welcome to tonight's Super 6 draw for today, Tuesday, the 24th of November, 2020. I am Iva Satney. Super 6 is a multi-jurisdictional game owned by Winlot Inc. and is played in the $140,000. We'll now select the free ticket letter. Good luck. Winning numbers.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Now you love Super 6 even more. With more money,
To the jackpot galore.
play more.
Win more. Have more fun.
With more jackpot money,
Super 6 is my number one.
With the new and improved Super 6 team, the jackpot keep growing and growing.
I'm growing.
more jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game. Super 6, bigger jackpots, more chances to win.
Now for your winning numbers. Good luck. The first number is 7. The second number is 12. 14. The fifth number is 5. And the final number is 13. Once again, tonight's winning numbers are 7, 12, 28, 14, 5, 13. And the free ticket letter is J. Tonight's winning numbers were drawn under the supervision of an auditor from BDO. Please contact your relevant Central Lottery office for chances to win. Join us for our next Super 6 draw on Friday, the 27th of November, 2020. Until next time, I am Iva Satney, wishing you a pleasant evening.
Welcome back. It's Dr. on Call and our guest this evening, Dr. Devron Joseph, and we are talking this. And of course, there are certain risk factors for type 2 diabetes, and I want us to look at some of those, and of course also we would sort of weigh in on how we can prevent it. So let's talk about it, and we can probably start with probably the most common one, obesity.
Yes. So, yes, as you alluded to, obesity is one of the major risk factors for who are not considered diabetics, do have some level of insulin resistance just from the fact of being obese.
Okay. Mm-hmm.
All right. As much as obesity also plays a part, your genetics and family history also plays a role in that. So if you have especially first generation families, relatives, sorry, meaning mothers, fathers, or grandmothers, siblings, all right, your likelihood of developing diabetes, type 2 diabetes for sure. Because so far, there hasn't had a concrete scientific evidence of one particular cause for diabetes, but they do notice a pattern as it relates to family history. So it's multifactorial. And so your family history plays a part, and then your lifestyle choices in terms of your intake it's just full of high levels of sugars and fats and less protein and more processed sugars and these things, right? Predisposes you to if you have that family history and already have that risk factor and already have the obesity, it predisposes you to developing the onset of diabetes.
Right. And so on the other side of that, we need to avoid that. And of course, you mentioned exercise, low sugar diet, and if possible, no sugar at all. Of course, vegetables and, your fresh green vegetables and things like that. So basically, killing two birds with one stone there. Yes. The issue of age, what role does it play in someone becoming diabetic?
Okay. So the general demographics of the persons developing, especially type 2 diabetes, it seems to be the onset in your third decade in life, late 30s, early 40s, right? So as you increase in age, your likelihood of developing diabetes also increases. Now, that has to be taken with a grain of salt, because we've seen the younger and younger populations developing diabetes, given the high prevalence of obesity, because obesity now is considered practically a disease in by WHO standards, in that is an epidemic, especially in places like North America, where about a third of the population is obese. Right? So the obesity seems to be playing a greater role in the onset of persons getting diabetes, instead of the age being a greater factor, even though it is. Right? The age, as you increase in age, you're likely your chances of getting diabetes are much higher than a younger person, but it seems that the obesity has more of a influence, more of a greater factor in influencing the diabetes.
Yeah, it has more weight. Yes, indeed.
I see what you did there.
You just catch up.
I see what you did there. That's pretty clever.
All right, yes.
Pretty clever.
We mentioned family history. The issue of pregnancy in women. We've known that some women who are pregnant, they tend to develop diabetes. One, why, and then can it go away after pregnancy?
Okay. All right. So what you're speaking about is something we call gestational diabetes. And a lot of women who have been pregnant or who would have had that in the past know exactly what we're talking about. So gestational diabetes stems from the same root cause, where there's insulin resistance developed usually later on in pregnancy, like the third trimester. So the mechanism is poorly understood, but for most of the scientific community is centered around some hormones released by the placenta during pregnancy, during late stage of the pregnancy, that causes the insulin resistance. That's why usually around the 28th week of pregnancy, all pregnant women are supposed to be screened using a test called O'Sullivan's test, all right, where the women would be asked to come in and do a blood test, and that will screen for the possibility of gestational diabetes. So to answer the second question, yes, it does go away after the pregnancy because, again, the insulin resistance is induced by a hormone released during the pregnancy. So after you would have delivered, then the hormone levels would drop and the insulin resistance should go away and you should return back to normal. One caveat, though, is that there is a percentage of women, very low, but that can go on to become diabetics, right? So usually after the pregnancy, the doctor would advise them about 6 weeks afterwards, they have to get another test to see if their blood sugar levels are back to normal and if they're functioning okay. And if not, they can be diagnosed with diabetes afterwards. But generally, that's not the case, and they do recover after pregnancy.
Right. Now, there's, as a matter of fact, I only learned of this next condition or syndrome not too long ago. Something called PCOS, polycystic ovary syndrome. It seemed to be a common thing, but probably a lot of women are not familiar with it. Can we talk a little bit about that?
Okay. All right. So the polycystic ovarian syndrome, all right, is a condition that usually associated. It's an endocrine condition, meaning there's some hormonal problems associated with that, where your ovaries are developing multiple huge cysts. These are fluid-like cavities on the ovaries that are very large and very prominent and do cause hormonal imbalances. So these women usually end up with irregularities in their menstrual cycle. They're usually obese women, and they do seem to have some issues with facial hair growth. It's a syndrome that's usually also associated with elevated blood sugars. Right? In itself, it's not diabetes, but it does have a component of insulin resistance. All right? And it's that constellation of symptoms would warrant them to see the doctor and get that checked out. But in itself, it's not diabetes.
Okay, but can someone, let's say, develop diabetes if they have that condition and it's not treated?
They can develop diabetes because in itself they do develop insulin resistance.
Right.
And the insulin resistance is the underlying mechanism for which diabetes functions. So the hormonal changes that are associated with that predisposes them to diabetes.
Right, okay. Another big one, smoking and alcohol.
Okay. So smoking and alcohol in themselves don't cause diabetes.
Okay.
Right? But they do exacerbate diabetes. Just think about smoking and mainly the smoking, even though alcohol, it does play a factor, right? The smoking damages your blood vessels and arteries terribly. All right, it predisposes you to cancers and other things like that as well. But as it relates to how it works with diabetes, just imagine diabetes also damages your blood vessels, and these two things compound in each other. They're like another addition to Bonnie and Clyde, right? They basically have the same goal of destroying your arteries. So smoking compounds it a lot. Smoking also lowers your immune system. All right? Diabetes lowers your immune system. Chronic alcohol consumption lowers your immune system. So there are a lot of bad actors that if you put them together would bring about a swift end to you. So that's why they're considered very toxic habits and should be avoided completely, especially if you have diabetes. Right? You don't want to compound one problem that's already damaging a lot of your organ systems with something else that's just going to do the same thing, right?
Right. Okay. Great. Although we had mentioned it earlier, but the diagnosis of diabetes, we could just briefly touch it again.
Okay.
Yeah.
Okay. So let me touch on like all the criteria for diagnosis.
Right.
So, the most common one we know is your fasting blood sugar. You don't eat anything for 8 hours. It's usually overnight. You would have gone to bed. You wake up in the morning not having eaten anything that has calories for 8 hours, and you go and get this blood test done called your fasting blood sugar. A fasting blood sugar of over 126 milligrams per deciliter, right? That's the value that we use, 126 and above. That's diagnostic. Usually has to be done twice to confirm the diagnosis if there is no other symptoms.
Right.
All right? That's one. There is also another criteria where it's called an oral glucose tolerance test. That's less frequently used, where the doctor might give you a certain amount of sugar to take, and then you record your blood test 1 and 2 hours afterwards. And if that is over 200, that's also diagnostic. Another criteria is if you're presenting all the classic symptoms of diabetes, including the increased frequency of urination, you're drinking, you're excessively drinking water, you're getting this blurred vision, you have the weight loss, you have all the overt signs of possible diabetes, and we randomly test your blood sugar and it's over 200, then that's diagnostic. All right? If you're not having these symptoms and you test your blood sugar randomly, over 200, that's concerning, but not diagnostic. Finally, which I think I should emphasize more, there's this newer test called the HbA1c, A1c for short, right? It's a value that checks on how high your average blood sugar has been over the last 2 to 3 months. It's a very, very reliable test. And once that's over 6.5%, that's diagnostic, right? So there are many criteria. Your doctors might choose maybe 2, including your A1C, which all diabetics, by the way, should know what's the A1C, because it provides a metric for control of the diabetes over a span of 2 months to know if you've been good.
Right. So, Doc, we'll take our final break, and when we come back, we'll invite some calls, and we can just briefly touch on the preventative measures. So, let's take a break. We'll be back in just a moment.
All right.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carriacou, and opens Monday to Saturday, 10 a.m. through to 7 11 p.m. Visit or call Hills and Valley Medcare Center today, 435-6904.
From Monday, November 2nd to Thursday, December 31st, GBN's Christmas Caravan will be blazing the trail of goodness across Grenada. Join us as we journey daily to find the hottest deals this Christmas season. Win prizes from our partners. Get recipes for your favorite Christmas treats and bust a tune in the Christmas Karaoke Fun segment. It's GBN's Christmas Caravan. Weekdays from 10 a.m. to 12 noon. Live on Classic Radio 105.5 and 105.9. GBN Television Channels 7 and 11. GBN's Facebook page and GBN's YouTube channel. Your mid-mornings will never be the same.
The Christmas Caravan is brought to you in part by Hubbard's and the Food Fair Supermarkets, Kittens Healthcare, Sissons Paint, and Bryden and Miners and Ace Hardware.
GBN Television News at 7, a pulse on all things Grenadian. Look out for our new features through expanded synergies with our media partners in Barbados, St. Lucia, Jamaica, Trinidad, and beyond. Capturing the latest in news, sports, weather, and entertainment. Credible, informative. Thank you for making us number one. News at 7, live, Monday to Friday on GBN Television, Channel 7 and 11. K105.5 and 105.9, Hot 98.5 and 98.7, GBN Television Facebook page and YouTube channel, and www.gbn.gd. GBN, with you anywhere and everywhere.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
Welcome back, folks. It is just about 28 minutes gone past the hour of 9 o'clock. So our telephone line is open. If you have any questions that you would like to ask, or if you have any contribution or an experience you want to share with us, you can do so now. Our telephone number again, 435-2041. We're talking about diabetes, remembering that November is recognized as Diabetes Month. All right, so the number again, 435-2041. Doc, preventative measures, what can we do? And there are quite a few of them. We could just probably go through them briefly so that people can be reminded of the importance of prevention. And I know in medicine, every doctor, one of the things they try to impress upon people a lot is preventative measures.
Yeah, that's important because the curative methods are a lot more expensive than the preventative measures. When we think about diabetes, we're looking at kidney disease that could end up in end-stage kidney disease, which requires dialysis, thousands of dollars a month for therapy. Right? It can end up in like heart attacks, end up in strokes. Right? That's what diabetes causes. So preventative measures, you start off with just your diet. Start off with your diet where you're decreasing the amount of carbs that you intake. all right? You skew your diet towards more of the proteins and the fruits and vegetables. So imagine you have your plate, you cut it into four or divide it into four. A quarter of your plate should be your protein, the next quarter should be your carbs, and then the next half of your plate should be like veggies and things of low calories, so that you can systematically control your diet. Then it's weight loss. I mean, weight loss includes your diet, but you need a exercise program, meaning that you need to at least do moderate to high intensity aerobic exercise at least 2 or 3 times for the week. All right, 30 minutes of brisk walking, or 30 minutes of whatever exercise regime that you're going to do. Right? Resistance training, meaning those who opt to use weights and go to the gym, that's optional. But at least some aerobic exercise. If you cannot run because of your knees or whatnot, some brisk walking would do, swimming would do. All right. So weight loss, diet, all right, and exercises. Just becoming active is your main goals. The other thing is checkup, right? As much as some people might not consider that a preventative measure, if you catch the disease early or in its inception, all right, and you're able to implement measures early, then you prevent a lot of the complications. So those of you in your mid early 30s or late 30s, mid 40s, right? You haven't seen a doctor in forever or never have seen a doctor. You need to get yourself checked out, at least annual or biannual checkup to screen for these things.
Okay, great. So someone along the way did not take the necessary preventative measures, and so they've ended up they become diabetic. How do we treat that person? So we're talking now about living with the condition. What is involved? We're talking here treatment. What are some of the things that individual need to do? What are some of the things that they should not do, and all of that? Medication,
Okay. So starting off with non-medication treatment, everything that we mentioned to prevent it goes right there in there when it comes to treating. So you're trying to prevent with diet. Now that you have it, you have no choice. Your diet has to change completely, right? We do have dietitians and nutritionists who can advise at the hospital what the diet plan for a diabetic should be, and they do a fantastic job with that. And then once you get your diet on track, you need to enroll in some form of aerobic exercise. And this is no longer trying to get that fit body anymore. No, this is about life and death now for you. You need to be get into an exercise program and increase your metabolism, because that does help with your insulin resistance and your caloric consumption, and helps bring down the blood sugar. And then at least lose 10% of your body weight and sustain that. And that's as it relates to treatment without medication.
Right.
After that, now, once you're diabetic, most diabetic would know about metformin. That's probably the most well-studied and documented drug that helps with improving insulin resistance, decreasing your blood sugar, all right, over time. So metformin is one of the main drugs. There are other oral drugs, meaning drugs you take by mouth, pills and tablets, that are available. Some people might know diamicron or glycoside. That's the name of the drug, the generic name. All right. These are other oral medications that your doctor will prescribe for you. There are host of other options, most of which it is in the American market. Some of them are pretty expensive, but the ones I mentioned so far, the diamicron and the metformin, are cheaper alternatives that your doctors would prescribe and do control it well if you do that in conjunction with your diet and your exercise. These medications do help with controlling the diabetes. Finally, if oral medications, the pills doesn't work, all right, what will happen is that you eventually need to go on insulin, right? Your body's not producing enough insulin, or the insulin required is to control your blood sugar becomes a little excessive, so you have to inject insulin into the body.
Right. There's something called diabetic neuropathy.
All right. So diabetic neuropathy, right? That's another one of the long-term complications of this disease. Like I said, it's a horrible disease. So once your blood sugar remains elevated for long periods, it also damages your nerves. All right. So it usually affects like the longest or longer nerves in your body. So it starts with sometimes burning and tingling sensations on the tips of your fingers, or also on the soles of your feet, right? Because these are actually your longest nerves, the nerves that are to the extremities of your body. And that can end up in some sensation loss or some burning or pains under your feet as a complication of the diabetes. It's important because one of the big implications of that is diabetic foot, right? What happens is that when you lose sensation to the soles of your feet, right? Your persons, they don't feel any sensation of discomfort and trauma. So when their foot is being constantly subjected to trauma, maybe in a shoe that is squeezing them, or they're walking around. Sometimes these people are farmers, and they're walking around bare feet, and they get a nail puncture or get trauma to the foot, and they don't feel it, and the foot becomes infected, and the foot becomes very, very tough to treat because, again, poor healing, etc. And it eventually ends up in complications where persons can even lose the foot because of the severe infection and damage to the blood vessels there. So the diabetic neuropathy usually causes decreased sensations or sometimes burning sensations in the tips of your fingers and your feet. And that leads to problems later on with trauma to the feet. Right? That's why you see a lot of diabetics. They
lose the limb.
They lose the limb. All right, so they need to take special precaution and special care with their feet once you know you're diabetic.
Right. The other one, diabetic retinopathy.
Okay, so diabetic retinopathy, it's a disease that affects your entire body. So your retina is actually the layer at the back of your eyes. All right, so diabetic retinopathy it's basically destruction of that part of your eye that could lead to actual vision loss.
Blindness.
Right. Yes. So it destroys all the blood vessels that supply nutrients to the back of the eye, and the retina is where the light focuses when it enters the eye, so that you can see. All right. So if that gets damaged, then you will have vision loss. I mean, as we're still in the eye, they also predispose you to cataracts and other things like that.
Right. And then diabetic nephropathy.
So nephropathy deals with kidney damage, right?
Right.
It's a very well documented disease, and it's one of the major causes, apart from high blood pressure, for chronic kidney disease in our population, right? the diabetes, like I said, continues to inflame and damage the small blood vessels in the kidneys and ends up damaging the kidneys to sometimes beyond repair and becomes end-stage kidney disease where it's not reversible and you end up needing dialysis. Right? That's kidney damage, again, associated with the high blood sugars and uncontrolled diabetes, all of which can be avoided once the disease is well controlled, or at least slow down the process.
Right, and of course we did mention heart disease and stroke throughout the program, and we know how dangerous that can be. We also mentioned the fact that diabetes is becoming more and more common in young people, and that's worrying, because young people in the prime of their life, when they should be doing a lot to develop themselves and do stuff, they get this chronic condition, and if it's not well controlled, then you end up in a rather unfortunate situation. So what would you say to young people as it relates to diabetes? And let me also just add in hypertension in here as well.
Okay. Well, for the younger folks, it's imperative, especially if you're obese. All right? For obesity, some persons who are obviously obese would know themselves. But as a medical definition, there is something called the body mass index. That is basically a metric based on your height and your weight that gives you a number that puts you in a range, right? So anybody who's above 25 is considered overweight in terms of their body mass index. And anybody who's over 30 in their body mass index is considered obese, right? These charts can be looked up online, and once you plug in your weight and your height, then it'll give you that number for you, for males and females. So as it relates to young persons, you could calculate your body mass index, and if you're within that overweight, obese category, then that should be a red flag for you. And to, one, check your doctor so you can get your blood pressure checked, you could get your blood sugar checked, and then you embark on a journey to lose some of that weight. All right, and that would be my best recommendation as it relates to young persons, because you're young but you're not immune. All right, if you have family history, meaning parents and other relatives with it, you're at risk. So you should keep that in mind. Lose the weight, check your doctor.
All right, wonderful. So our telephone number again, folks, 435-2041. If you have any questions, you can ask now because we're getting close to wrap-up time. The number again, 435-2041. And we just want to remind people that it is important to pay very close attention to yourselves, what you eat, what you drink, the importance of daily exercise. And as Doc says, you don't have to go running a marathon or have to go to the gym every day and lift 500 pounds. 30 minutes brisk walking 3 times a week can actually help you to keep yourself in check, and that's very important. Doc, just for information, we may not be able to have exact, but okay, we have a call. Let's go to the telephone and we'll come back to my question. Doctor in call, good evening. Hello.
Hello, good night.
Yes, go ahead, please, caller.
Yes, good night, Doc. I had a reading this morning at 110. Is it high or low?
That's actually normal. That's good. 110 is a normal reading, and as a diabetic, we want to make sure that your blood sugar before meals should be under 130, and after meals, about 2 hours after meals, it should be less than 180. So less than 130 before meals and less than 180 2 hours after meals is what our target is for diabetics as it relates to their blood sugar control. Mm-hmm.
Okay, thank you very much.
Thank you, caller. Thank you very much indeed. All right, 435-2041. And folks, as Doc said, you can go online. As a matter of fact, you can just Google BMI, and it will take you to calculate your body mass index, and you can just put in your weight and your height, and right away it would give you that. All right, so it's very easy to do, and you would have a good idea whether you need to lose a few pounds. I can't ask you to lose some height because but you can lose a few pounds, so it's not difficult. And there are ways, there are easy ways, even now more than before, that can help us to keep ourselves in check. Doc, would it be correct to say that someone who's diabetic or diabetes is not a death sentence?
That's correct. Mm-hmm. Diabetes is not a death sentence. All right. There are many persons who are living with diabetes now, and you would not even know because they're on top of their diet. They're compliant with their medications, be it the oral medications, the tablets they take by mouth, or be it insulin, and they avoid the vast majority of complications as it relates to the diabetes, and they end up sometimes living a full life without complications of the diabetes, right? So it's not a death sentence.
Okay, right. So it's almost wrapping up time, Doc. What we can just quickly do before we wrap is just to quickly summarize what we spoke about as it relates to diabetes, the importance of preventing it, and how to keep yourself in check so that you don't become a victim of that very, very serious condition.
All right. So, like I said, diabetes is a condition associated with persistent elevated blood sugars, right, due to lack of insulin or insulin resistance. All right, if you do have risk factors for diabetes, or you do have diabetes, some of the measures you want to take is your diet needs to be paramount, right? Mm-hmm. Decreased number of carbs, right? You want to if you're overweight, you want to lose some of that weight. You want to engage in aerobic physical activity at least 3 times a week, 30 minutes brisk walking. If you're into resistance training and in the gym, better yet, you go ahead and you can practice that. If you are diabetic and your doctor puts you on a regimen to take your medications daily, and you need to monitor your blood sugars. Ideally, you need to get a glucose meter and get your strips. Mm-hmm. Be accustomed, get accustomed to taking your blood sugar readings before every meal, at least in the first instance, until you're very well controlled. Like I said to the caller before meals, your blood sugar should be less than 130. 2 hours after meals, it should be less than 180, and that's a good control. Mm-hmm. The other thing that needs to be checked on is your A1C. Every diabetic should know what's their A1C, and that's a metric for how well your sugar has been controlled over the last 2 and 3 months. If you haven't done one, just remember you need to do one every 3 months minimally to check to see how you've been controlled. All right, you can avoid a lot of the complications if you put in the time, put in the energy, you take your meds, you get to an exercise regime, you lose some weight, and you'll avoid a lot of the sinister complications. Oh, and final point, all diabetics, you need to have your foot checked. You need to look at your feet daily, because you can lose sensation in the feet without even knowing. and end up in a lot of problems, including infections and loss of your limb, because you're not vigilant. Okay?
All right. Okay, Doc, I want to thank you. I thank you very much for spending time with us this evening and to, of course, reinforcing the points as it relates to diabetes. You know, folks, we can prevent it, as you heard from the doc. We can prevent it. And if per se we do have it, we can live with it. If we just do what we are asked to do by our medical professionals. It is not difficult. Change your diet. And the thing is, you know, a lot of times we think, well, boy, vegetables and so, but in a short time, if you use veggies, you acquire a taste for it, you know. And after a little while, you'd find it very, very, very delicious. Not so, Doc?
That's right.
Yes, you do acquire a taste for it. You do acquire a taste for it. So let's try our best to prevent diabetes and other chronic conditions. And while we're still in Diabetes Month, let's make that special effort to at least do a little exercise. And if you did not exercise for the month so far, you still have a little over a week. Do some. Do it. It will not hurt. So, Doc, thank you once again, and we look forward to having you on the program again soon.
All right, soon.
Yeah. Okay. Thank you very much, and do have a good night. Yes, indeed.
Right,
all right. Thank you very much, folks, you know, for staying with us. It was indeed a pleasure bringing to you the information on a doctrine call this evening as it relates to diabetes. And please, reminder to take good care of yourself. All right. Also, remember, if you are diabetic, it means that you will have an underlying, or you have an underlying condition as it relates to COVID-19, because we still have cases, which means you have to protect yourself. Yeah, wear your mask, maintain the physical distancing, continue to sanitize, and protect yourself. Because if you are diabetic and you do contract COVID-19, you are more at risk than someone who do not have an underlying condition. So once again, please protect yourself and stay safe. Thank you very much, folks. That's our program this evening. You can join me tomorrow. Again, I'll be back with you from 6 tomorrow, Wednesday. Our Release It program. Alan will be here, and as always, we have a lot to touch on. So until then, do have a good night. All the best.
Drug abuse, cancer,
measles, diabetes, AIDS, cancer,